Hello friends, I am Dr. Harsh Mathur from Om Netralaya, Varanasi, India, and today I will be discussing how I have evolved doing phacoemulsification in 2023, my pearls of wisdom and tips and tricks. So the first is using these Liberman guarded speculum with solid blades gives a good retraction of the eyelids, and after draping keeps the surgical field clean and devoid of any eyelashes. The second thing which I am doing is using this globe stabilization ring, which helps me stabilize the eyeball and induces minimum trauma to the blood vessels. The third is using this 20 gauged angled MVR blade to make the side ports, which is repetitive and helps while I am doing phacoemulsification and inserting the chopper and the Bimanual IA. The fourth is using Phenocain or T plus ultra, gives a good dilatation and also gives a good anesthesia. After staining the anterior capsule and washing the dye, the chamber is filled with OVD. Now I am stabilizing the eye with the help of this Sinski while creating this main incision. So right now the Sinski has pushed the eyeball outwards, and now once this keratome goes in, it pushes the eyeball towards the keratome and helps in creating a nice main incision. Now initially I have been using this cystitome to create the rhexis, but now slowly but steadily I am switching over to the utrata forceps. So I have marked these utrata forceps at 2.5 and 5 mm with the help of the blade. So these marks I have created by my own, and these help me judge the size of the rhexis pretty nicely. And I have got a good 5 mm of rhexis. Now jet of fluid is injected, the opposite pole is tapped, the same is repeated, and now rotating the nucleus with this hydrodissection cannula. It's very easy if the nucleus is of a good density and you have done a good hydrodissection, and it also saves a step. So once I'm sure that the nucleus is rotated nicely, now I'm going in with my Cataract 3 phaco machine probe. So it's an excellent machine to do a direct chop. The hold is excellent, and I'm using this karate chopper which has a blunt edge and the inside part is for the cutting. So going in the substance of the nucleus, getting a good hold, this chopper goes to the far periphery, moves towards the probe, and then laterally separated, and I've got a good crack. Again, the key is to get a good hold of the nucleus and chop. So I aim to get at least 4 to 6 small quadrants. So whenever we are doing phacoemulsification in a 5 mm rhexis, it's a good idea to make small quadrants which are then easily emulsified. At the moment, power is 50, vacuum 400, and flow rate is 38. The key is to stick to the central safe zone, keeping the endothelial safe as well as the posterior capsule. So the probe stays in the central safe zone and all the hard part is done by the chopper. And now flipping the epinuclear sheet and then emulsifying, and that's it. The nucleus is managed. Earlier I used to do this cortex removal with the help of Simcoe cannula, but now I have switched towards the Bimanual I. It's an excellent tool. It gives 360-degree access. The chamber is nicely maintained. The eye can also be set at the primary position. And now is the time to switch the probes. So in no time, this cortex is dealt with. Always bring the cortex towards the center and then aspirate. So it will be safer to the anterior capsular rim. And that's it. The chamber is filled with OVD and the IOL is placed in the bag. The leading haptic goes in the bag. And the trailing haptic is then dialed in. So now the OVD is washed off, and I make it a point that I go behind the IOL and clean excessive OVD from behind the IOL in the bag, so that I get a nice quiet eye post-operative day with no IOP spikes. After thoroughly removing the OVD from the anterior chamber, now is the time to just inject the antibiotic, moxifloxacin, and then hydrate the wounds. I hope you like this video. Do let me know in the comment section what else I can do to improve my surgery, and what is it different that you are doing, and what is it that you have adapted to in your technique. Do like and subscribe to my YouTube channel and help it grow. And thanks for watching.